in a pivotal vote, Robert F. Kennedy, Jr., has been confirmed as the new Secretary of Health and Human Services. Dr. Smith, what implications does this have for the Trump administration's health policies?
This decision is indeed significant, especially since RFK Jr. isn't a traditional health expert. However, his leadership could introduce reforms that challenge the status quo, much like a CEO without a tech background successfully leading a tech company.
That's an interesting analogy. Yet, critics argue that his stance on vaccines could undermine public health efforts. How do you respond to these concerns?
Critics like Mitch McConnell highlight his vaccine skepticism, comparing it to dismissing proven emergency protocols. But RFK Jr. advocates for transparency and safety, not outright rejection, which could lead to more informed public health decisions.
Looking forward, could his appointment signify a shift in how health agencies operate under political leadership?
Absolutely, this could set a precedent where leadership skills are valued over specific expertise, potentially bringing fresh perspectives and fostering innovation in addressing health challenges.
Tulsi Gabbard, once a Democrat, now plays a crucial role in Trump's administration. How does her journey reflect the current political climate, Ms. Johnson?
Gabbard's shift highlights a growing trend of political realignment. It's akin to a sports player switching teams after realizing the new team aligns better with their play style, offering a fresh platform to enact change.
However, her detractors cite her past as a Democrat as a reason for distrust. Isn't this skepticism valid given her previous political stance?
Skepticism is natural, but Gabbard has consistently prioritized national security and nonpartisan governance. Her past debates on military policies showcase her commitment to these values, irrespective of party allegiance.
Do you foresee more politicians crossing party lines in the future, especially in polarized environments?
Indeed, as political landscapes evolve, adaptability will become crucial. We might witness a surge in politicians prioritizing personal principles over party lines, potentially reshaping political discourse.
Mitch McConnell was a notable dissenter in RFK Jr.'s confirmation. Mr. Brown, what were his primary objections?
McConnell's opposition stems from RFK Jr.'s controversial views on vaccines. He likens it to rejecting proven medical advancements, which, in his view, jeopardizes public trust in health institutions.
Yet, some argue that McConnell's stance is out of touch with current needs. Could this be a case of outdated thinking clashing with new perspectives?
Exactly. McConnell represents traditional views, but the public is increasingly open to exploring alternative health narratives, much like how consumers now embrace holistic medicine alongside conventional treatments.
What does this tell us about the future of bipartisan cooperation in health policy?
This highlights a potential shift towards more inclusive dialogues. As diverse perspectives gain traction, bipartisan cooperation could evolve to incorporate broader, more innovative health strategies.
The appointment of non-experts like RFK Jr. raises questions about the future of health leadership. Dr. Green, what are the potential benefits and pitfalls of this approach?
Non-traditional leaders bring fresh perspectives and can challenge entrenched bureaucracies, similar to how tech entrepreneurs disrupt industries with novel ideas. However, there's a risk of disregarding expert research and evidence-based policies.
Critics worry that lack of expertise might lead to misguided policies. How can administrations mitigate such risks?
Absolutely. If successful, this model could redefine leadership across sectors, emphasizing adaptive skills and collaborative governance to tackle complex, interdisciplinary challenges.